people join as needed. Well, hello, my name is Madeline Goebel, and I'm the Community Outreach Director for the World Food Prize Foundation, and I'm overseeing the implementation of the summit this year. I'm so excited to welcome you to our breakout session, Pantries with a Purpose. In this session, we will discuss the efforts of the Bismarck Burleigh Public Health Wellness Pantry and DMARC's Food Pantry 2.0. These opportunities leverage the critical partnership between health and food access to reduce the fight to end hunger. I'm so excited to have Katie and Taylor and Daniel with us today. Katie, as you'll see, serves as the Nutrition Services Coordinator at the Bismarck Burleigh Public Health. She's a licensed registered dietitian, nutritionist, certified lactation counselor, and she has a passion for improving community health through public health education efforts. Katie, would you mind raising or just kind of waving your hand so people can see you? Wonderful. Taylor is the Ending Hunger 2.0 Impact Manager at the Great Plains Food Bank, where she manages work at the intersection of hunger and health. This work aims to address the root causes of hunger and promote positive health outcomes for food insecure clients. Taylor, do you want to just say hi real quick? There we go. And then we have Daniel, who is the Data Analytics and Program Coordinator at DMARC and has been with DMARC since 2010. He is a passionate advocate for equity of nutrition and healthy lifestyle choices for the under-assisted communities that have long been deprived of affordable choices to improve family health and wellness. In his capacity at DMARC, he is one of the developers of DMARC's Health Incentive Food Pantry 2.0 model in an effort to involve the function of what a food pantry is, and is to include more choice-laden, dignified environments. To note, we ask that you do keep your microphones muted while our speakers are talking, but I really encourage you to feel free to unmute yourselves as you see prompts or questions or conversation starters from our speakers. I also highly encourage you all to turn on your cameras if you are able to. And again, just thank you for being here, and we're very much looking forward to the conversation. Katie.
All right, well, good afternoon, everyone. As Madeline said, my name is Katie Jonke, and I'm with Bismarck Burleigh Public Health. And today we are talking about Pantries with a Purpose and the great collaboration that we have going on with public health and food banks in our states. And so just to summarize what we'll be talking about today is we've had the opportunity to connect with individuals to healthy food through both Daniel and our wellness pantry. And these opportunities leverage the critical partnership that there is between health and food access to help reduce the fight to end hunger. And so hopefully today you'll learn about that collaborative effort through the statewide food bank and local public health and that network that brings healthy food to all food insecure clients. So we kind of have a panel of us. And so again, I know Madeline introduced us, but this is just a quick who we are. So you can read it if you weren't able to catch it verbally. And so I work at a local public health unit in Bismarck, North Dakota. Taylor is with the Great Plains Food Bank out of Fargo, North Dakota. So her and I are just 200 miles apart from each other. And then we have Daniel with the program coordinator with DMARC in Des Moines, Iowa, right where you're at. So we're coming at you from all different areas, and hopefully today we can help answer some of the questions and get you thinking about ways that you can advance health in your pantries, in your communities. And so please, if there are questions as we go through, you feel free to ask as we go. Otherwise, definitely we'll have a Q&A at the end.
All right, thanks Katie for the nice introduction. We are going to get started here just with a really brief overview of what a food bank is. I was kind of taking a quick peek at who's here in this session today, and I want to do some very quick level setting. So I am Taylor Sievertson. I'm the impact manager for a department at the Great Plains Food Bank called Ending Hunger 2.0. The Great Plains Food Bank is the food bank for the entire state of North Dakota. And so within our network, we have over 200 partners that help us feed people directly. Those partners are food pantries, soup kitchens, shelters, and other supportive programs. And here at the food bank, we also have a number of direct service programs. So ways that we actually get to serve people one-on-one, clients across the state. 1 in 6 North Dakotans are in need of food assistance. And this year we've seen, the need just increase in exponential ways. And we've also noticed that childhood hunger has grown significantly. A couple of years ago at the Great Plains Food Bank, we really have a very data-driven approach to the work we do, because we think it's important not to make assumptions about the people we serve, but instead hear from them directly. And so we conducted a statewide study where we had the opportunity to speak with over 500 clients of the Charitable Feeding Network one-on-one. We asked them, very intimate questions about their reality. What's their reality with hunger on a day-to-day basis? One of the things we really wanted to dig into during this time with folks was trying to understand what root causes are existing for people who are facing hunger. What are the things, the complexities of life that are bringing someone to need food assistance? And really, what are the other barriers that are keeping them from food security and sustainable progress in their food security? One of the things that we learned from this study was that health and chronic health were some of the things that came to the forefront, that bubbled up to the top. Chronic disease, health concerns, cost of medical care. And so this learning really launched our work at the intersection of hunger and health. We learned that of the people we were speaking with, about 75% of the clients we serve are facing at least one chronic disease. That's frightening, really. For people who are incredibly vulnerable, they're not only facing hunger and a lot of the issues that surround hunger, like poverty, but they're also having to deal with, every day, every month, a chronic disease that's limiting their ability to live a healthy life. So we know that for folks who are utilizing the Charitable Feeding Network, they're facing chronic disease at much higher rates than the general public. We knew that we needed to be part of that solution. The solution for people's health is more than nutrition. It's more than healthcare. It's more than food banking alone, but it's really the combination and the intersection of all of this work together. So we identified 3 programs or 3 models that would really allow us to work collaboratively with partners in the community that would really move the needle forward on both food security and positive health outcomes. So like I mentioned before, we think it's really important not to make assumptions about our clients. And so at the core of this work, we found that hunger vital signs screening, which is something some of you might be familiar with. It's a validated 2-question screening tool. That screening is really at the core of how we identify people who are facing food insecurity. And so as Katie will mention in a little while, and as I'm happy to answer any questions later on, Bismarck Burley Public Health and Great Plains Food Bank came together and really started to think about the ways that we could move food security and nutrition forward for our collective clients. We kind of looked at this model that we have as a food bank, where we identify people who are food insecure using that screening tool, and then we select one of 3 interventions. So the 3 interventions that are listed here are, referring people to existing food bank programs and local food pantries. We also have identified ways to connect people with SNAP or other long-term economic resources that can lift a family out of food insecurity. And the third way that we've determined can be very effective in moving our work forward is identifying, building, and hosting new food distribution programs. We do this in a couple of ways, but one of the most exciting new ways that we do this work is through a program that we launched together called Wellness Pantries. And wellness pantries are this really fantastic culmination of a lot of things. They're a pantry that's essentially located in a healthcare setting. Bismarck Burley Health was willing to kind of be a little bit of a guinea pig and test out this innovative idea with us. So they are the very first wellness pantry in the state of North Dakota. And the purpose of a wellness pantry is to identify people who are food insecure, clients, and then connect them with an immediate solution, an immediate food resource, alongside a few other things that are going to encourage behavior change, food consumption change, better food access, knowledge about what resources exist in our community, and really nudge clients toward making healthier choices for their own health improvements. And so that's kind of an overview of what a wellness pantry is, what it looks like from kind of the ground up. We have, in the midst of a pandemic, we've learned a lot. And I'll say that we launched this first wellness pantry March 1st. So about 13 days before the state of North Dakota declared a state of emergency. And so while we may have seen other impacts in a different year, we've seen some really wonderful outcomes so far around patients who have had better food access, who have potentially seen some behavior changes, and we're definitely still in the pilot phase, so we're still exploring what long-term outcomes exist. But I think that one of the most wonderful things is that patients trust their providers and their nurses and the people that care for them to help them improve their health. And we know that at the intersection of hunger and health, there's a lot of work to be done. And we're just really excited about this, this new intervention, this new opportunity. With that, I'll stop talking for now, and I'm going to pass it over to whomever is next. Daniel?
Yes, thank you very much, Katie and Taylor. As I said, my name is Daniel Beck. I do data analytics and program coordinating with Des Moines Area Religious Council here in Des Moines, Iowa. First of all, if you're looking at my camera, I want to apologize about the lighting. I had some connection issues earlier, and unfortunately, this is not to make me look more mysterious. It's kind of my only option right now. So I've got a stable connection, but it looks funny. So yeah, I just wanted to give kind of a brief overview about DMARC itself, and then the sort of development of this Food Pantry 2.0 model that I'm talking about a little bit today. What you're seeing on the screen right now, as Taylor alluded to with their program as well, we are also very data-driven. What you're looking at on the screen right now is it's part of some of the mapping that we do every day, every week, every month. We're doing a lot of locating clientele and everything to sort of pull more demographics and more specific information about who we're assisting. So what you're seeing on the screen is actually just the last calendar month, September of 2020. Excuse me, what the usage looks like in the greater Des Moines area. If you're from Des Moines, or if you're familiar with the Des Moines area, you might be a little shocked to see that the usage is everywhere. It's not just places that you would kind of expect, I guess, places that you're kind of told through narrative that hunger exists. It exists everywhere in all the suburbs, no matter how sort of affluent they may appear. It's everywhere. And I should point out as well that what you're looking at on the map, by the way, are not exact client locations. We do move these spots up to 200 meters in any random direction just to add a layer of confidentiality. So what you're looking at is just kind of a snapshot more than anything else. Again, so DMARC itself, we are a food pantry network. We sort of operate a network of 14 standing food pantries in the greater Des Moines area, as well as our mobile pantry, which at this point, effective in October, we're back up close to about 30 mobile sites. A lot of those specifically starting in October, we started partnering with way more of the schools, elementary schools and middle schools in the greater Des Moines area to try to sort of find pockets of need that we know or we may not be finding with our standing pantries. So yeah, like I said, a pantry operation starting in about 2009. We started working with, and you can go to the next slide, by the way. Started working with Iowa State University to look at sort of health, not only health outcomes, but the general sort of survey of health of the Des Moines Area Religious Council Food Pantry clientele. It was really interesting to go over some of what we found, but kind of the most stunning thing, and it was interesting that this was sort of relayed to us almost as kind of like a sidebar, like an, oh, by the way. The pantry population had 3 times the incidence of diabetes as the standard population, as the general population in the Des Moines area. So aside from the other things that we took away from this work with Iowa State, that was a wake-up call. For us, starting in 2010, that meant we had to start moving toward a more healthy model. We got rid of sort of the archaic, the older model of what a food pantry, I guess sort of what people think of with a food pantry where you're thinking, you know, macaroni and cheese and canned soup and ramen noodles. Not that I don't, you know, enjoy some mac and cheese every now and then too, but if it's the only options, it was not working. We were obviously contributing to this detrimental health outcome of food pantry population. So again, starting in 2010, we moved away from that, this complete shift toward not only more fresh produce, but also, you know, whole grains, low sugar, fat, salt options, things like brown rice as an option instead of white rice. You know, if we're doing like canned fruit, we, you know, started sending it out in juice and water rather than heavy syrup, things like that to just help the population out a little bit that was using the food pantry as we were able to. You can go to the next slide. So starting in 2016, we started kicking around this idea of Food Pantry 2.0. It's funny, you know, that the 2.0 name for us, I you know, heard it from the other side as well. It was literally just a placeholder for us. We were thinking like we're going to come up with a more creative name once we've got the details hammered out. Then we were just kind of out of creative juices once we had sort of set up the program. So Food Pantry 2.0 stuck. What you're looking at is actually like the apparatus that we started using after a long time. We did we got a grant from the Des Moines Community Foundation to sort of get the pilot off the ground, and that included software and hardware. What you're looking at is the actual shopping cart that exists. So what we actually established was a shopping guide that issued a 1 through 5 score of every single food item in the food pantry, 5 being sort of the least healthy, 1 being the healthiest. And the idea was that if we incentivize people to choose healthier options, that they would get more food items. Like if they chose, you know, predominantly 1s, 2s, and 3s, they would get more food than if they got 3s, 4s, and 5s. And, you know, it's interesting that, you know, Katie and Taylor have used the word nudge, because that's exactly the word we used the entire time as well, as we were kind of debating the start of this program. It was a cumbersome process. So again, I'm happy to take any questions along the way about sort of the scoring model and everything like that. I'm trying to keep an eye on the chat as well. But literally what this amounted to once we got the pilot up off the ground is that people would literally shop through the food pantry. It was no longer, you know, X number of category items, like X number of grain or anything like that. They got to choose at will. And then we would use the little scanner to score items, you know, basically count down items as the shopping was going along. So theoretically, if they chose like all 1s, they could get, you know, like 36 items per person. 1s were a little bit hard. It was a little bit hard to come by those because that's very low salt or very low sugar, according to the scoring metric that we were using. Yeah, so that was the pilot that began in September of 2017. I know that what you're seeing on the screen now is very hard to see. Unfortunately, I couldn't really condense it much more than what I was able to here, but I'll explain to you what we're looking at. The Nutri-Score, as we call it, the Nutri-Score trend, meant the average score of all items selected. So what you're looking at is from September of 2017 through the end of 2019. And if you can see that, what you see is that our average started out around 2.3. That was every item selected by every person. The average score was 2.3. Going to December of 2019, where it was lower at 1.86, which is, I believe, the best score. I think tied the best score we had the entire time. So it was just this gradual improvement, this sort of, like I said, this sort of nudge into healthier choices along the way. Of course, March of 2020 hit, and we all know what started happening then. So we have actually had to, unfortunately, stop the program during the pandemic because we weren't able to do full in-person contact food pantry shopping. But as you can see with the Nutri-Score trend, we were really moving in a very positive direction as far as the average scored items. You can go to the next slide. Kind of the other metric, really the most important metric we were also looking at was also produce selection. Again, I know these charts are very hard to see. I'll kind of explain what we're looking at. On the left, you see July of 2017, which is our first month of baseline data, data that we were collecting without any incentive. So like we were collecting choices, but we're not yet incentivizing healthy choices. What you can see from this, if you can see it, is about 36% of every item selected was fresh produce. And then if you go again to the end of 2019 on the right, December of 2019, it's over 51%, I believe, of everything selected is fresh produce. So again, moving in this direction of whole grains and low sugar, fat, salt, and especially, like I said, fresh produce, which is ultimately, the best things we can send out of the food pantries. So we just saw that number going up more and more and more as far as everything they selected, that percentage. So again, looking at the sort of outcomes that we were hoping for, that we were hoping to see, Nutri-Score, the average score trending downward, and the percentage of produce being selected, we have seen a very, very positive movement. Again, unfortunately, leading to 2020, where we've had to suspend this. We've talked more about sort of the evolution of what this program looks like. And again, this is where I'm very happy to field any questions, especially about data or kind of what we see for the future of the program. We've talked openly now about like a Pantry 3.0 model, which would probably be another name that sticks. But that would not only include incentive and nudges toward health, but would also include an educational component to this. We want not only to say this item is better, but this item is better because. And then also actual health outcomes. We've done a pilot program locally here as well that included biometric testing of Food Pantry 2.0 clientele if they chose. It, of course, wasn't forced on them. It was purely volunteer. But basically just looking at biometric data for individuals, and then if they were following this sort of 2.0 model, the selections from Pantry 2.0, to do follow-ups with biometric to see, is this nudge having a positive effect on health overall, not just kind of the concept of what a healthier diet is, but that is this education, are the selections being made actually coming out with better health outcomes, better health numbers. So that's kind of, as I said, 3.0, unfortunately, like I said, we were discussing this in early 2020, and it's just all on hold right now until who knows when. The reason we're doing this virtually right now instead of in person. But that, again, that's kind of the future of what we've talked about, is not only incentivizing healthy choices, but including education, including health outcomes, and then even including things like partnering with, gyms or yoga studios or things like that to say, if you do these things, you'll get more points at the food pantry. You'll be able to access more food at the food pantry if you're following this sort of what's considered like healthier lifestyle, including mental health as well. So we also talked about museums and art centers and things like that. So that's, again, kind of in the works for the future of what the 2.0/3.0 model would look like. But again, just as I said, going through the end of 2019, we've been seeing just sort of nothing but positive trends in the data we've been collecting thus far. So Taylor, I can't remember, did I have another slide on there? I'm sorry. Okay, I didn't think so. I thought that was it.
All right, well, hello everyone. So I will talk to you about our wellness pantry here at Bismarck Burley Public Health. And as Taylor alluded to in the beginning, this is a partnership between their Great Plains Food Bank and our local public health unit. And so the two pictures are what it looked like upon setup. And as Taylor said, we did launch March 1st, which was super exciting, but things definitely didn't get their full press, if you will, just because of everything going on. But it has been a great success thus far. And we just took an old exam room that an unused exam room in our office and some cabinetry that was being utilized elsewhere and just installed to create this space. And so as you can see on the little chart there, so far we've had 124 total visits, and this is unduplicated individuals that have come through. We've distributed about almost 2,300 pounds of food with an average about 18, 19 pounds per household. And the amount that they can take is based off their household size. We really talked a lot about how do we indicate how much someone can take. And we just based it off of household. So whether you're a 1 to 2 household, a 3 to 4, or 5 plus. And then it is allotted per food group. And so as you can kind of see on the one photo, the pantry is organized by food group. So green, vegetables, fruit, protein, etc. And we do offer, the one nice thing about this pantry too is we do have the fridge and freezer component. And so we do have access to fresh and frozen produce, which is our number one, I don't want to say seller because we don't sell it, but our number one item that is chosen. And it is very difficult to keep in stock, actually, which is great because that is showing people want these things. But it's also kind of a negative in that this is what people are wanting and aren't able to get maybe on their own. And so when they access our pantry, that's the first thing. I will say that how this process works is this is for clients only at Bismarck Burley Public Health. So you do have to be coming to our office for a service or be a client of one of our services. And I say that because we do serve some clients off-site and just through telephone support, but they also are able to participate, and they are just provided with a voucher that is mailed out that allows them to come in one time during that month then to receive this service. We don't limit it to the number of times you visit as long as it is tied to a service. So we do have some clients that come in weekly for med fills or maybe twice a month for other things. And as long as they are there for a service, they could then utilize that pantry at that time. So for the most part though, people are coming about once a month. We did have one client say, you know, this is the healthiest food pantry they have seen. And it really is. I mean, we really focus on whole grains, canned and fruits and veggies. We have protein options and really looking for the better choices. We do have things like granola bars or trail mix. So again, including the nuts and the M&Ms. So it's just understanding that there's a balance between the food choices. We did create nudges, as was mentioned earlier, and if you can see, there's little signs placed on some of the shelving, and that was to indicate maybe the health benefits and then maybe examples to what to do with that. So for example, under the brown rice, it was what's the nutrient benefits of brown rice, or under the black beans, some of the foods that maybe people don't utilize as much or aren't familiar with. We tried to educate them with some recipe tips and then nutrient profiles for those foods. Additionally, I've also included meal to go kits. So putting items together that are a meal in a bag. So spaghetti in a bag, like chicken rice soup, chicken noodle soup in a bag, tuna hot dish in a bag. So it's the main ingredients that they would need to create that meal at home. And that is also supplemental to the items that they get to pick. So that's a bonus bag on top of it. Depending on our supply, they also have maybe additional snacks that maybe they fit into a category, but not really. But those are things that they can also enjoy. And we're seeing what we were seeing too, that during the core of the pandemic, or in the beginning, I should say, when we had very limited services. In fact, our office was closed for a little while, but open to just very kind of as is needs. Obviously, we didn't have the foot traffic, but once we started opening again, but schools were closed, and so kids were still at home with their families, we saw more of those snacks and items going out more, because again, the kids were home from school and not maybe getting the food that they had during the school day. And now that we are fully back open, and clients are able to come in and use the pantry. At this time, as to how it works during the current situation, clients are masked, staff is masked, but really as staff that walk through it with them, we kind of enter or let them get in, kind of explain if they haven't been there before, and then we as staff just kind of step back or kind of in the doorway, because we aren't there to watch them. We don't want them to feel like we are watching what they pick. We're really just there for questions, and really just let them shop in the pantry. They do have to weigh it upon exiting, as that's how we track our distribution. And then there is, if you can see on the wall there, just on the left of that top picture there, that is an iPad actually. And we do have the client check in every time and collect some basic information, as we are too looking at longer term health benefits beyond just the behavior changes maybe of how you shop or what foods you choose. And so on this slide, I just wanted to kind of summarize what makes it difficult for families to feed, or for people to feed their families, and cost is obviously a significant barrier, but then also availability and transportation, which we do see in our other programs and services that we have here at Public Health. Transportation is a huge barrier, and we've worked on some other transportation projects, if you will, to provide in order to get them here for services. And so I can see how that is a barrier. And then on the left, the purpose for their visit, we do ask them why they are here at Public Health, or what brought them in today, just so we can understand what type of clients we are serving from what programs. And our health tracks is children under 19 that we serve, and our immunization clinic. So again, children, families. And then nurse of the day can be really anything. So it could just be you go there for your flu shot, or someone else. So it could be families again. But just kind of a quick summary as to where we're seeing our highest numbers. And then we did use the pantry to also support some individuals through COVID response that may have tested positive and were quarantined and isolated during their time. And so we used it a little bit to support in the beginning when things weren't as established under COVID response as it is now. We don't utilize it that much for COVID anymore because we have other resources in place, but that is always an option too, that if we are providing them a service somehow through Public Health. And so with that, that's really the summary of the pantry. It's been a great resource, and I'm really excited to see how this goes further. And what we tell families, again, this is just supplemental. It's not meant to feed their family for a week or feed them for a month. It's just extra food to help maybe get them by or connect them. And that's one thing too, when we do screen these clients for hunger, we use the two questionnaire, hunger screening, and then through that, they can use our service, but then we really do try to connect them to other services in our community. So maybe they do qualify for SNAP, or they need to attend another food pantry, or we really just offer them other services. So we're not the only service that they're getting, but really looking to connect them with those services in the community. So it's kind of a conversation point too, and opens up those doors a little bit. Other things that we have put into food bags and have handed out are family table conversation starters, and even things on tobacco and smoking, because we're thinking that if we can get any education into them, maybe this is the way to do it. And the family table conversation cards are great because it really does emphasize eating together as a family, which is a whole nother presentation in itself, but really the focus on family meals and taking it to that next step. So with that, that's all I have. So I think now we can open it up for questions, and we really are looking for the participants today to really join the conversation that we have had, and we are happy to answer any and all of your questions.